Hi everyone, welcome to Converse-Nation where we talk about everything and anything. My name is Afra and I have with me
Adia, and today we're going to be discussing on cosmetic surgery. Before we start, we would love for you guys to like, share, and subscribe. And don't forget the notification or to click on the notification button so you don't miss any of our future discussions. So today, like I said, cosmetic surgery. So I'm going to start with Afra, let her kind of go over what her opinions are, yay or nay, for cosmetic surgery.
For me, cosmetic surgery is both yay and nay. That's yes and no. For those that don't, I think everybody knows what yay and nay is anyways before. Yeah, so for me, it's both a yes and a no. And I'll start with the yes. Because cosmetic surgery is an invasive procedure that alters a person's physical appearance, right? And it's for non-medical purposes. So for people to judge or criticize cosmetic surgery, to me, what cosmetic surgery is the same thing as makeup is. That's altering your physical appearance. Because people that do professional makeup, when you see the before and after, they don't look the same, right? And then some people are born with crooked teeth, and when they put braces on. In a matter of months, everything is straightened out. So their physical appearance is also altered. And I checked, about 80% of women wear push-up bras. They don't wear the actual size of bras. So it's still altering physical appearance. You want to appear like you have bigger boobs or bigger bumps. Some people wear bum and, and hips, the fake ones. So everything is about altering your physical look. People use bleaching products just to be lighter. To me, it's altering. So that's why I try not to judge people that maybe are uncomfortable with the way they look. So I think the problem here is because it is invasive is why people tend to, it's bad, it's this, it's that. But the point is, there's no procedure, there's any procedure that requires them sedating you is dangerous. There's no procedure that is not, that doesn't have risk. Even if it's appendectomy, whatever it is, C-section, people, it's risky. People die from it. So that's my view on cosmetic surgery. That's my yes. That's why I do not have a problem with it. So I don't know what you think about that. A lot of people might not agree with me, but that's just my opinion, right? So.
Yeah. Well, I'm happy to say that I do agree with you on the yes aspect because I'm a woman. I mean, I just feel like the way we put makeup, like you said, it's similar if it's not an access, like access. Access, right?
Excess.
Thank you. English is not my first language, so as long as you're not taking it too far, it's not that bad. People have a lot of other reasons why they do. Even there's some medical reasons why they would do something that's called cosmetic instead of general surgery, right? So I'm all for it. I just feel like do it for the right reasons. Don't do it because you're trying to impress someone. Do it for yourself. So later you don't regret your decisions because it is risky. So when you weigh out your risks and benefits, like, does it make sense? Do you really need that big butt? Do you really need that big boobs, bust or chest, or are you trying to, you're a mother that just gave birth and you're trying to just, do a little mommy makeover, which is not much, so that's my opinion on it. So I don't have anything against cosmetic surgery unless you're trying to do the most excessive thing and putting your life at risk. Now, like we touched on, there's a lot of risk factors or your own nays. Why do you think we shouldn't or people shouldn't be doing cosmetic surgery?
Yeah, like you said, like you mentioned, what we see these days, social media is pressuring people, puts people under. They have this image that they project that a perfect woman should look like. If you don't have curves, then you're incomplete. If you don't look a certain way, you're incomplete. Even for the braces, dentists they have this idea of what a perfect teeth should look like. If you have gaps, they try to close it and stuff. So it's all projection in the media. They make people, it affects teenagers more because a lot of girls have low self-esteem. So if you are doing cosmetic surgery because of that, then the motive is wrong. Like, it should be because you want to do it, not because you want to look a certain way, because you have insecurity issues.
Yeah.
You think once you do it, then people will love you more. If you don't love yourself, nobody will love you, no matter how big you make your butt look or your boobs. So that is where it is a no for me. Because growing up as a teenager, at some point I was a late bloomer. So everybody was having boobs and butt, and I'm like, what's in the happen? Come out now. So for me, I was insecure as a teenager. Then it got to a point I got to have a mindset shift. Like, I'm more than my body. So the moment it shifted, man, the confidence, it's character. In fact, some people were interpreting it as pride, but I just loved myself the way I was.
Yeah.
And I noticed that people liked me because I loved myself. I had a lot of people wanting to be my friend, or in fact, I had a lot of people that actually wanted to marry me as young as I was. So that was when I knew that you're more than your body. It's not about beauty. You know, the model Alec Weck, she not get anything. She's straight. I even me, as straight as I am, I have more curves than her. Yes, that's the truth. But if you see, like, she's a high profile. She was. I don't think she's still into modeling. She's black. Like, she's as black as black. And people, her watchword is that she believed she's beautiful. Yeah. And everybody saw her as beautiful. She's on low cut. She's bald. Everything. And then she was accepted. Like, she was a top model then in her days. So that's when I knew that no, this beauty of a thing, this reason that people are killing themselves, it's not worth it. They should not be pressurized by what they see on social media. That's it for me.
Okay.
So I don't know what you think. I know there are lots of risks. You might want to talk about the risk of
So the risks that I have here, which, everybody has to remember that, like you said initially, that every surgery there's a risk to every surgery. It doesn't matter what it is, because sometimes we don't know how our body's going to react, right? So like for plastic surgery specifically, they'll tell you that there's like infections that can happen after the procedure. Scarring. So you could go there trying to make yourself look good, and then you end up with scars that you don't want. If you guys have ever watched the show Botched, basically it's just a show on,
cosmetic surgery gone wrong.
Thank you. And these like doctors in LA are trying to fix what other doctors have, where they've gone wrong, pretty much, right? There's access bleeding, which we know that have led to a bunch of deaths, right? If even in the social media, we probably have seen someone passed away from,
people die from,
simple, it's not simple, like Botox. Exactly. Or what's that one where they liposuction, BBLs, they just go because there was an infection or bleeding, blood clots, right? We all know how dangerous that is, nerve damage, because we forget how technical like our bodies are, the way that it's delicate, built. Thank you, with all the nerves, any small thing. The doctors are humans, they're not robots. So they're bound to make mistakes. And we also have to remember that. But I think the issue with a lot of people in society, I've even caught myself do this, is that when you see things that, you're making a decision and they said, these are the risks, these are the benefits, you don't really, psychologically, you don't pay attention so much to the risk. It's like those little agreements, what is it called? When you read a contract and at the bottom, it has all the...
You don't even read the terms and
nobody
conditions.
reads it because...
Yes.
You know what you want,
click.
And exactly, you make up your mind and boom, you click, right? So there's fluid buildups. There's also separation at incision sites. So just think about going to the hospital. That's what I always tell people. I'm scared of needles. I'm scared to be put to sleep. I'm scared that I won't wake up. So when you go to the hospital and they're cutting you, the doctors take it very seriously. Why do you think that you doing the same thing, except it's called cosmetic surgery, will not be a risk to you, right? So that's where I stand. It's usually weigh out your risks. Do you actually need to do it? Because to be honest, there's a lot of men out there that have different preferences on who they want to be with. Same with females. Not every man wants somebody with big chest. They can settle for a big bum, flat chest. Okay, some girls are built that way. You're good. Some men like big breasts, not so much in the back. You're good for that. So why do you need to alter yourself? why do you need to take that risk? If it's not for you, like I said, for me, if you need to do it, some people have like really big breasts where it causes back pain for them and they need to do breast reduction. To me, that's like something that's a yay.
That's reasonable.
It makes more sense. Or, you know, if you go through weight loss, I don't know if you've seen like my 600-pound life.
Where they take out some of the fat.
And then even if you work out at like 300 pounds, you have skin.
The loose skin is a lot.
Right? So I think there's things where you can do.
Yeah.
And the benefits outweigh the risks.
Yeah.
Right? So
like she said, if you're doing it for a reasonable reason, like they say it's non-medical, but there are some medical reasons as to why you need cosmetic surgery. If you're doing it because you want to look good, you want to pepper them, you want to then I pray just go to a good doctor, right? Make sure you go to a good cosmetic surgeon. And then I have a problem with young girls that go and do it. You never born, you never marry, you never born, you're doing it. When you have one baby, then one child, you now go again and do it. Stop looking at Kim Kardashian and all the celebrities. Hey, don't compare yourself. Like the doctors they have are the 1% of the best. So if you keep doing this to your body over time, you don't know what will happen when you are 40, 50. When you have one child, and if it's 3 children you're going to have, you keep redoing it. Hey, that's danger zone. God will help you though. So for me, for mothers that have diastasis recti abdomen, it's a condition that where the abs separate, the muscles in the ab, it's DRA they call it, and a lot of people don't know it. No matter the crunches you do sit up 20 million years, it makes it worse. So that was the mistake I did when I had my baby. I was doing crunches. I found that it was getting worse. It wasn't tightening the muscle. So I went to read up. So I did the research and I found out that was all I had. So I started doing the exercises online. Up until now, I still have the big stomach. Like if I don't eat, it's flat. The moment I eat, it looks like I'm 2 months pregnant. And with the chiropractor that I saw said, it would take like from a year, like it would take 6 months to a year. In fact, sometimes 2 to 3 years before it works, before the particular exercise works for it. So I'm like, why should I start when I might have another baby? Okay, I'll take 1 year, 2 years to do a particular exercise. And then I will now come and expand it and tear the muscle again. So it lose more, like the abs, it separates. So nothing is practically holding the stomach. Anything that goes in just bulges out. So most mothers have it. If you see any woman that's giving birth and she has big belly, don't be quick to judge and say, she did chop too much. No matter what you do, like I've lost weight everywhere. I even have, in fact, if I want to do surgery, I'll add to my clavicle. I have conga. You see, I'll put fat. If I wear armless, you see it. So a lot of people have issues. Some is the arm, and like you said, the ones that have big boobs, they have to reduce it. And when you lose weight, you must have loose skin if you don't cut it off. So for the people that have DRA, is usually tummy tuck. A particular I don't know if I should say, it's like an ex-president's wife went for it and she lost her life in the process, and she was really judged. She go do this one, she go that. I think that's wrong because she's had children and then her body is not the same. And maybe she doesn't like what she sees in the mirror. Like I have loose skin. When my stomach is flat, I pull it, it's stretchy. So I can decide that I want to do it if I like. And it to me, that's why I said it's not wrong if you have the right reasons, right?
Do it. Yeah.
So,
and I just have to tell you, like I told a lady yesterday that she was complaining about her stomach, but she had kids. She had twins, and she said since then her stomach never went down. And I don't know. I see it as a hero stripe.
Yeah.
If you're a mother and you've had kids, I don't think anybody should judge your body because what you go through. I haven't had kids yet, but just from looking at my mother and all the mothers around, it's something that you can never explain. And people should stop focusing on that. Think about what that woman's body actually went through.
Yeah.
It really doesn't make any sense to judge them because until you do it, and you can just do like Beyonce, and you guys don't understand people's bodies are different. So
some people snap back. Some people don't.
So
and then it's dependent on how big the baby was, right?
Exactly.
So that depends on how stretched. So that's just the way it is. I think we've practically touched all the aspect, the medical implication, the and the nay part of it.
Yes. So just don't judge people. You don't know what situation they're in, right? Even skin bleaching, people think that's actually cosmetic altercation. You're changing your skin.
Exactly.
Right?
So it's more like you're judging one person for a different sin.
To me,
some people say that sin. You're sinning differently. You're judging someone else for sinning differently, but you're actually still sinning. And God sees everything as the same.
Yes.
I don't know about if you think it's wrong. You can put it on the comment section. If you think it's okay, you can drop your reasons and in the comment section also. Because morally, I don't think it is wrong. And it's also wrong depending on the motive why you're doing it. So it's actually yay and nay depending on how you see it. So that's it for me.
Same here. So you guys remember, we would love to hear from you. You guys can drop down other topics that you'd like us to discuss here, right? So we just want this to be a community where we can all talk about the same things. What do you want to hear?
What do you want us to discuss about? That's why it's called Converse-Nation, right? Yes. You drop whatever topics you think you want to hear people's view about. Drop it, then we'll talk about it, and other people will comment. That's how we learn. We don't know it all. No man is an island. All right. Thank you for watching. Don't forget, again, like she said, please like, subscribe, share.
Bye.